I grew up in Boston, just a little bit west. I'm the oldest of 7. I decided out of thin air when I was 9 that I wanted to be a doctor. I was immediately a rock star for at least a day at home when I shared this with my mother.
The medical school was basically brand new.
A new school sounded appealing, and when I went for an interview there pretty early, I was completely enchanted.
She was always a rising star. She was always a force. She always had a presence.
We were the first full class of 100 at that time, and it felt very, very personal, and that everyone was there to help you succeed.
She had laser-focused thoughts on leading people, but also had a gentle side of empathy and humility.
Dr. Clancy and I go back a very long ways. She and I have interacted professionally now for over 2 decades. It began when she was the director of the Agency for Healthcare Research and Quality, one of the key operating divisions of the U.S. Department of Health and Human Services. There are people in the United States that benefit from high-quality care, and they will never know that name, Dr. Carolyn Clancy. And yet, through example after example after example, she is directly affected and affecting the care that people receive.
The sense of mission that permeates this system had a lot to do with why I came here to work. That and my own father's experience being quite sick when he was in the Navy. He had rheumatic fever, and back in the day, that meant sitting in a hospital for about 9 months. My current role, and the name of our group, or the acronym, is Dean. So I occasionally tell people I am the Dean, although that is not an actual job. Includes academic affiliations with nearly all of the nation's medical schools. We now support the training of about 1/3 of U.S. medical residents. So we've got a big imprint on the future, and we support the training of about 60 other types of health professionals. It also includes our Office of Research and Development, and then last we've got a group doing healthcare innovation. I think the opportunity for students to actually serve and learn from veterans in a VA facility right on campus is just amazing.
It was at your medical school, at your university, where Dr. Clancy got her start. It's there that that foundation, that deep-seated commitment began. It was in the hallways and the classrooms of your medical school that this individual, whose work has now benefited not just hundreds or thousands of individuals, but millions of people in terms of improving their care, preventing errors, improving accessibility to care, improving care quality. It all started with you and in that environment.
She really tried to make everybody better. And she made me a better physician, just knowing her.
I would say I've been very, very lucky. A great education, great opportunities as a clinician, and I like what I do for work.